ABA therapy is critical and life-changing for your child or clients with autism, but insurance doesn't always cover, and paying out of pocket is extremely expensive. When Lorri Unumb found out and it wouldn't be covered for her son with insurance, she decided to take matters into her own hands. I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author. Each week I share some of my tips on turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Today, I'm sharing a small excerpt from my podcast interview with Lorri Unumb, in which we discuss her fall into the autism world with her two sons, one of which is on the severe end of the spectrum and one of which is very mild. And we talk about Lorri's efforts in changing the law, first in her home state and then throughout the United States, and why she decided to take action on a legislative level. Yes, I'm so thrilled to have Lorri Unumb here. Lorri is both an autism mom as well as an attorney, and she led the insurance reform in the United States. So tell us about your fall into the autism world and how you got started and when that was and where you went from there.
Well, I like the way you phrase that, fall into the autism world, because that's an accurate description of how I started this journey. My firstborn child was diagnosed on the autism spectrum shortly before his second birthday. And at that time, I really didn't know what autism was. I had heard the word, but that's about it. And when the doctors recommended ABA therapy, I had no idea what they were talking about. I barely even understood the concept of therapy. We were very lucky. My husband and I met in Washington, D.C. We were both young lawyers with the United States Department of Justice. I think we were lucky that we lived in the Washington, D.C. area because we had access to some really very fine diagnosticians. And we took advantage of 3 of them. I had been on the waiting list so long to get an appointment that when I ultimately got one, I think the first one we got was at Children's National Medical Center. And
how long did you wait for your first appointment?
Months and months. I cannot remember the exact, but it was many months. And, that seems like years when you don't know what's going on and you can't get an appointment with somebody to tell you what's wrong with your child. There was really no question. They said he has autism. But then I think it was Kennedy Krieger that called next, and we had come up for an appointment. And I said, well, let's just go ahead and see if their doctors agree and if they recommend the same thing. So we went for another diagnostic evaluation, and they said, yes, this child has autism, and gave us recommendations. And then Georgetown called. We had been on the waiting list for all 3. So we went ahead and talked to the doctors at Georgetown as well. And really, I'm not just a neurotic parent. I just thought, we've been waiting that long. Let's get advice from all 3 different institutions. And I look back and I think how fortunate it was that we did get advice from a variety of people, because they all mentioned ABA therapy. And again, I didn't know what it was, but I was like, Georgetown mentioned this, Children's mentioned it, Kennedy Krieger mentioned it. Let's figure out what that is. I recall when we brought ABA providers into our home to kind of explain what it was and how it worked, and how there'd be people coming into our home. And then we got around to the point about cost. And again, our son is very severely impaired, so he really had been recommended for a very intensive program. We were looking at a 40-hour per week program, and the ABA professionals just basically laid it out. And I was doing the math. I'm like, that's going to be like $70,000 a year. And I remember turning to my husband and saying, my gosh, thank goodness we have health insurance. What would you do if you didn't have health insurance and you got this diagnosis? I didn't know that health insurance would not pay for 1 penny of it. My first concern was not, oh my gosh, I've got to go change this law. My first concern was, oh my gosh, how are we going to get this for Ryan, right? initially I was just concerned about, do I quit my job so I could be home with Ryan? But then if I quit my job, how are we going to pay for the therapy? It's a very difficult conundrum. And we, as a family, ultimately decided I would not quit working. My husband and I would both work full time. We would live on his salary, and my entire salary would be used to pay for Ryan's ABA.
Wow.
And we did that for a few years, but I got to tell you, I could not sleep at night thinking about, okay, so we have made it work because I'm a lawyer and I happen to make enough money, and my husband makes enough money that we can live on his salary and fund an ABA program with mine. But obviously, that's a very small fraction of families that can just handle it that way. I knew from the LOVA study, from researching online, I knew that this wasn't going to magically, recover my son or whatever. But I knew that there was at least a 50% chance that he would do so well, he might be mainstreamed in school. I knew that I wanted him to have a shot at being one of the best outcome kids. And I kept thinking about, again, all the families where their children weren't even in the pool of kids who had a shot at achieving best outcomes because they couldn't access the intervention.
Well, it's not, it's a medical condition until it's time for treatment. And then it's education. Well, the education is like, no, it's not education. It's medical. Because it's so expensive, nobody wants to pay with it. It was like a hot potato. Like somebody else is going to have to pay for it.
That's exactly right. And when I got kind of to my boiling point that I was just so frustrated on behalf of the less fortunate, really, I thought about, well, I'm a lawyer, maybe I should sue to under IDEA to get better services educationally. But I remember having a flip chart in my office, and I kind of drew out all the systems. I'm like, education has a role to play, healthcare has a role to play, state social services has a role to play, the family has a role to play. And I looked at all of those and I said, well, this group is trying. I mean, they're not living up to the best standards, but they're trying. And this group is doing something. And I looked at the healthcare system and I said, well, they're not doing anything. In my mind, they were not contributing to intervention for autism in any way. In fact, they were doing the best they could to stay away from it with a 10-foot pole. And so that really kind of focused my mind. I could spend the next few years suing under IDEA, or we could look at the health insurance industry and try to figure out a way to get them into the mix again, because they were just not helping at all. So that was part of the decision making on that front. But you're absolutely right that everybody just wanted nothing to do with it. And when I first started researching the healthcare component of it, I saw that Wisconsin had taken some steps to create funding, Maryland had, Pennsylvania had, but that was, well, and Massachusetts was funding it through the education system. California had the regional care system, but most people in the United States had no access.
What point did you start advocating in other states?
Right. So initially I just had the idea that I thought insurance should pay for ABA and whatever evidence-based treatment is recommended by a physician for autism. And I had that when I was living back in South Carolina, and I researched it. I learned that insurance is typically regulated at the state level. So this is something that had to be addressed at the state level. So I wrote a piece of legislation and asked a state legislator to introduce it for me in South Carolina. It was a very long, difficult 2-year battle to get it passed, but I really didn't have my sights set on this grander kind of national reform movement. I was just trying to fix in my state what I knew was a problem. I was doing it purely on a volunteer basis as a mom because I thought it was the right thing to do. But after it passed, I started that in 2005. It passed in 2007. And shortly after that, Autism Speaks reached out to me and said, we think that's a really neat law that you got passed down there in South Carolina. That's good policy, and that ought to be the law everywhere. So why don't you come work for us and make that our mission to replicate that law in all 50 states.
I hope you enjoyed this short excerpt with Lorri Unumb. If you would like to learn more about joining my online course and community, you can attend a free online workshop at marybarbera.com/workshop. If you like this video, I'd love it if you would share it with others. Give me a thumbs up, leave me a comment, and I'll see you right here next week.